It's great to be joined with Dr. Kathy Short, the Executive Director of School Mental Health Ontario, a critical partner in the Ministry of Education, supporting all school boards and all schools in this province, promoting positive mental health. And during the pandemic, we know how important that is for Ontario parents. I want to do a bit of a check-in with some of the best experts in the field about how we can best support you, Ontario's moms and dads, and of course our students who are watching. So thank you so much, Kathy, for your team's commitment and leadership really over the past year. It's been a great partnership. And I want to really start with just understanding what schools are doing today in the context of promoting mental health and ensuring access to those services.
Thank you, Minister Lecce. We know these are really hard times for students and their families, and that everyone's COVID-19 story is different. And so the importance of student mental health has really come to people's mind more and more. And we're lucky because schools are doing a lot of really tremendous things every day, and this gives us a chance to share a little bit about those. So the first thing I'd want to say is that mental health is a good thing, something that we want for our children, for ourselves. And it's interesting because sometimes when people talk about mental health, their minds go to mental illness and some of the most serious forms of that. Our job in schools is really to promote student mental wellness every day in our classrooms by creating welcoming conditions. And the other thing that we have is school mental health professionals who are there surrounding our educator colleagues with professional supports for students when they need help. So we have trained social workers and psychologists and others who are well trained to provide services when students need a little bit more than that daily dose of wellness. And I can share more about that as we chat.
I think for a lot of parents out there, they're interested to know what are those signs, those early signs or late stage signs, but really what should they be looking for, Kathy, in the context of changes in behavior? Given that many young people are learning online, the social distance and the reality of young people being away from each other has impacts, no doubt. So, what would you advise to Ontario parents of knowing the signs and acting early on them?
As parents, you know your children best. And so you know what different looks like. You know what changes when changes happen. So we all have our ups and downs, especially now. But if you're noticing things in your child that are sort of a dramatic change or much different from what they would usually feel or behave, then it's something to pay attention to. So I'm going to actually list a couple of questions that you might just want to reflect on as you're listening in to help you to think about that. So does my child seem more sad, withdrawn, or irritable? Sometimes sadness shows up as irritability. Do they seem more fearful or clingy, panicky, or worried than normal? Have they lost interest in things that they normally enjoy? Are they having trouble eating or sleeping? Are they more easily frustrated or angry or verbally upset, sort of outbursts or temper tantrums, more than you'd usually see? Are they having trouble concentrating or shutting down? Those sorts of things would be the things I would be thinking about right now. And mild problems in these areas, again, are very typical. The question is, how big of a change is it? Is it getting worse? Is it lasting longer? And if the answer to those things is yes, don't panic because there's help available and you're certainly not alone in this.
Yeah, I think understanding, what your broader message would be to parents who have those concerns, either those that have seen those changes that are manifesting in their children and also those that want to avoid those experiences. What would your message be to moms and dads out there today?
I think that the biggest message is to trust your instincts. I mean, you do know your child best. I'd add that mental health problems are common. They're not a sign of weakness, and there is help available. So I think one of the biggest things that we carry as parents is that right now we aren't always feeling like the best version of ourselves in every moment, and we can be really hard on ourselves. So I think it's really important to just not to be too harsh with yourself and to recognize that we're in the middle of a global pandemic and you're bringing your best every day. And most days, most moments, you are doing a great job. So if your child is struggling with a mental health problem, acknowledge it, tune in to what they might be feeling, lean in, and do your best to help. So taking care of yourself, taking a breath, and holding on to hope is important. And if you're concerned, open up a conversation with your child about what you're noticing, and then really listen as they try to express their feelings. That can be hard to do. It can be hard to put your feelings into words, and that's a skill. It's actually a skill we're trying to teach students at school. So let them know as they do that that you really understand how they might be feeling, and then explain how it is that you get it. So, for example, if you might say, "Thanks for letting me know that when I go to the grocery store, you feel upset, and that's why maybe I'm seeing that you're having trouble on Mondays. I understand that because you care about me and you're worried that I'm going to get sick. But would it help if I told you the kinds of things I'm doing to stay safe?" So being able to really show the child that you've heard them can go a long way. And if in the course of that conversation you remain concerned and the kinds of things you would normally do don't feel like they're quite enough, it's a good idea to reach out to your child's teacher or principal and see if they're noticing the same sorts of things and what strategies they've tried that might be helpful. And then work as a team. If more is needed, they can help you to reach out to a school mental health professional like a social worker or a psychologist or others who can be helpful. And sometimes it's just little things that can help you to get back on track. If students are quite upset, they can also reach out as you can to see about getting help in the community. And we can talk about some other places you can turn to.
Yeah, well, I think for a lot of parents, the question is, what are those resources? Who best to turn to? How do you access them? So maybe walk a parent through that process and just give them any tips, given that there's a higher rate of concern from a lot of parents out there. And no doubt they're already turning to some of those resources, but they'd like to know how they could access them within schools across the province, both English and French, urban and rural, in all regions of Ontario.
Absolutely. Some of the places that you can go if you do, if you're able to access internet, there's many places to build your own mental health knowledge. We have ideas and links on our School Mental Health Ontario website. There's also a really nice parent resource hub at Children's Mental Health Ontario, and they have lots of good supports for your children while at home. Um, it might be helpful for folks to know that students will be learning directly about mental health and staying well and asking for help using a student mental health action kit that's recently been released. And you can again see that on our website. And you might find that some of the ideas that our teachers will be using could be helpful at home. Students can also turn to the COVID-19 Youth Mental Health Resource Hub. This is a collaboration between us, jack.org, and Kids Help Phone. Lots of good resources, social media shareables, ideas for ways to calm when young people are feeling stressed or panicky. One of the things I would note is that there, as well as these good information sites, there's also lots of misinformation about mental health. So it's really important that you start with reputable sites that are based on research. In the community, parents can reach out to their family physician, to a cultural or faith leader, to a knowledge keeper. There's lots of folks that can help. Um, there are also community mental health organizations, and through Children's Mental Health Ontario, you can actually go and find a center, and you can find out where one is near you. Um, so, first step probably, or for many, will be within the schools, but I just wanted to round that out to say that there are other resources as well. And I think in the schools, probably the best starting place is your child's teacher or principal.
And for those parents that are seeing more serious concerns, behavior and actions by their child in the context of their mental health and the challenges that they're trying to get through, what would your message be to those parents if it's a bit more serious than some of those early signs? If they think it's at a point where there needs to be intervention, how would you advise those parents?
Yeah, it's really important to act quickly in these cases. And again, the earlier you can act, the better it's going to go most likely. So, if it is a serious mental health emergency, like a suicidal behavior, then call 911 or visit your closest emergency department. That is an emergency situation. We have a resource on our website currently. It's called Prepare, Prevent, and Respond, and it has to do with suicide prevention. And I really would encourage all parents to review that. It's not something that any of us wants to think about or ever wants to believe that that could happen to our child. but knowledge is really the key to prevention. And so within that resource, it gives you some warning signs, some things to look for, and some very clear actions that you can take in the moment, some conversation starters, and also ways to get help in your local community.
Dr. Short, I am grateful uh, for uh, for your ideas, for your recommendations, and most importantly, for the work you're doing every day to help us save lives and keep young people motivated in this province. 2 million youngsters are very much looking up to their educators and their school administrators for access to those services. And I think arming parents with that information is going to help them support their kids and keep them safe in all aspects of the word. So I just want to thank you and your team for the work you're doing every day, joining many other medical practitioners and stakeholders that work in our schools to ensure all young people have access to the mental health services they deserve. Really appreciate the message, and I think the undercurrent of which is an element of optimism that with those resources, with that information, that you can get through this difficulty and that you can lean into and many of the good people within your community, wherever you live, that can provide the support that will catch your child better. And I think that's a good message to conclude on. So thank you so much, Dr. Short, for the work you're doing and for your ideas and for your good recommendations to Ontario parents today.
Thank you. Thanks for inviting me.